Honorable Chairperson, respected Principal, Director, respected teachers and my dear colleagues, Assalamu alaikum and a very good morning. Today I am very grateful and it is my very pleasure to welcome all of you in today's clinical meeting on key concepts of diabetes mellitus with laboratory diagnosis. Today's chairperson is Professor Dr. Nazma Parveen Ansari, Professor and Head of the Department Pathology, and research person is Professor Dr. Mirza Hamidul Haq, and speaker is our beloved Dr. Fazilatun Nessa, Associate Professor, Department of Pathology. Now, I would like to request Professor Dr. Nazma Parveen Ansari and Professor Dr. Mirza Hamidul Haq sir to take their seat and conduct the rest of the session. Thank you.
দোয়া করিস কোনো পড়াশোনা নাই ও হেরা তোমাকে ইনভাইট করবে পরে তো যাবো না
Learned audience, Assalamu alaikum. In this fine morning, I welcome you all in our weekly clinical meeting. Diabetes mellitus is a chronic metabolic and modifiable disease. In our session, we will discuss about the key concept of diabetes mellitus with laboratory diagnosis. Our speaker is our beloved colleague Fazilatun Nessa Halima. He is a graduate from this institution and doing DCP. Now I am requesting Dr. Fazilatun Nessa to deliver her speech.
আসসালামু আলাইকুম থ্যাংক ইউ ম্যাডাম dear honorable teacher and my senior and junior colleagues. Now I started my uh, clinical meeting on key concept of diabetes mellitus with laboratory diagnosis. Diabetes mellitus is a group of metabolic disorders sharing in the common feature of hyperglycemia. Hyperglycemia results from defect in insulin secretion, insulin action, or both. Diabetes mellitus is derived from history of diabetes mellitus. নিচে হলে ভালো দেখা যাচ্ছে না স্যার প্রথমতে যাব না স্যার আচ্ছা Diabetes mellitus. Diabetes mellitus is a group of metabolic disorders sharing the common feature of hyperglycemia. Hyperglycemia results from defect in insulin secretion, insulin action, or both. History of diabetes mellitus. Diabetes mellitus is derived from the Greek word diabetes meaning siphon to pass through and the Latin word mellitus meaning honeyed or sweet. This is because in diabetes excess sugar is found in blood and urine. আবার যে চলে গেল This disease is known as since 250 BC. Insulin isolation and clinical use was started in 1921 by Benting and Best of Canada, and for this he got the Nobel Prize in 1923. Use of oral hypoglycemic agent has been started since 1955. Prevalence and incidence of diabetes worldwide. The World Health Organization estimates 422 million people suffer from diabetes worldwide among the total population of 8.2 million in the world. Approximately 5 billion billion in the world. Approximately 5.27%. In the age between 20 to 79 years, the incidence is 10.5% according to the International Diabetic Federation in 2021. আবার কই আমার এটা ডিস্টার্ব করতেছে অনেক। আচ্ছা আচ্ছা Incidence of diabetes in Bangladesh. International Diabetic Federation reported the total number of diabetic people is nearly 13.1 million in Bangladesh, which is the eighth position in the world in 2021. By 2045, it is projected to move to the seventh position, with 22.3 million people with diabetes. The annual average treatment cost of per diabetic patient 25,473 taka only. Top 10 countries of territories number of adults 20 to 70 years with diabetes 2021 and 2045. um, 2 years China is the first position during her overpopulation, and Bangladesh is 8th position in 2021, and 2045 is 7th position. Type types Diabetes is two types mainly. Type 1 beta cell destruction, type 2 insulin secretory defect with insulin resistance. Type 1 beta cell destruction, here immune mediated and idiopathic. Type 2 insulin secretory defect with insulin resistance, which also includes genetic defect in the beta cell function. Sorry. Genetic defect in beta cell function, এত ডিফেক্ট তাহলে নিজের ল্যাপটপটাই লইতাম। তারপর জেনেটিক ডিফেক্ট ইন ইনসুলিন অ্যাকশন, ডিফেক্ট ইন এক্সোক্রাইন pancreas, endocrinopathies, infections, drugs, genetic syndrome associated with diabetes, gestational diabetes mellitus. Type 1 versus type 2 difference. Clinical onset usually childhood, type 1 childhood and adolescent, type 2 adult. Weight type 1 normal, type 2 obese. Insulin type 1 decrease, type 2 increase. Islets cell antibodies positive in type 1, negative in type 2. Ketoacidosis common, type 1 rare, type 2. Concordance twins 50% in type 1, type 2 90 to 100%. HLA, hemolymphocyte antigen linked, are no association. Pathogenesis, type 1A, autoimmunity, genetic susceptibility, environmental factor, mechanism of beta cell destruction. Type 2, genetic susceptibility, environmental factor, beta cell destruction, insulin resistance. Mm, uh, the, the pathology insulitis, no insulitis, beta cell depletion, mild beta cell depletion in case of type 2. Here metabolic action of insulin. Insulin mainly target three organ, act on three organ, liver, skeletal muscle and adipose tissue. তাহলে আমাদের ল্যাপটপটা নিলেই তো পারতাম। হ্যাঁ, এবার কি করতাম? হ্যাঁ, in liver decrease gluconeogenesis, increase glycogen synthesis, increase lipogenesis. In skeletal muscle, increase glucose uptake, glycogen synthesis, protein synthesis. In case of adipose tissue, increase glucose uptake, increase lipogenesis, decrease lipolysis. আগেরটাতে চলে যাচ্ছে। Pathogenesis of the complication of diabetes mellitus. Complications are due to metabolic derangement, mainly hyperglycemia, mechanism non-enzymatic glycosylation, glucose plus protein. This is reversible, measured by hemoglobin A1C, glycated hemoglobin, and age, advanced glycation and product. This is irreversible. It is binds on protein of vessels in capillaries. Albumin bind to basement membrane, that is glomerulus, to receptor on cells. Intracellular hyperglycemia, without insulin, glucose can enter into the following cells and structure such as nerve, lens, kidney and blood vessel. Hyperglycemia, increased intracellular glucose, sorbitol, fructose, intracellular osmolarity and influx of water, osmotic cell injury. There is damage of Schwann cell, that is peripheral neuropathy and retinal microangiopathy and pericytis. Insulin decrease, glucose cannot enter in the muscle and adipose tissue and decrease glycogen. Hyperglycemia, intracellular water reduce, thrust center is activated, that is why dysphagia and polyphagia. Glycosuria and osmotic diuresis causes polyuria, loss of water and electrolytes, and protein and fat catabolism occur. Diabetic ketoacidosis, decreased insulin, breakdown of adipose store, increased free fatty acid, ketone bodies, ketonemia and ketonuria. Now we are going to the laboratory diagnosis of the diabetes mellitus. Urine examination, here glucose, ketone body and protein. Variety test used for sugar. Uh, this is the test of Benedict test. Here color change occur. Now we are in many laboratories. Stiff test for ketone body, blood sugar, protein also. Heat coagulation test for protein, stiff test detection for protein, and blood glucose estimation. Fasting blood glucose level, normal 70 to 110 মিলিগ্রাম পার ডেসিলিটার, আর মিলিমোল হচ্ছে 3.6 থেকে 6.1 মিলিমোল পার লিটার। ইম্পেয়ার্ড গ্লুকোজ টলারেন্স 110 to 125 মিলিগ্রাম পার ডেসিলিটার, মিলিমোল 6.1 থেকে 7.8 মিলিমোল পার লিটার। ডায়াবেটিস মেলিটাস মোর দেন 126 মিলিগ্রাম পার ডেসিলিটার, মিলিমোলে মোর দেন 7.8 millimole per liter. Random less than 140 milligram per deciliter. Impaired 140 to 200 milligram per deciliter. Diabetes more than 200 milligram per deciliter. 2 hours after breakfast, more than less than 140 milligram per deciliter. In diabetic patient, more than 200 milligram per deciliter. Glycated hemoglobin assay here, normal 6.5 per level equal or more than 6.5% in diabetic patient, impaired 6.4% and normal 5.7%. Oral glucose tolerance test is the confirmatory test of diabetes mellitus. Here some indication: mild asymptomatic diabetes mellitus, strong family history, elementary glycosuria, renal glycosuria. To detect renal threshold, history of stillbirth, spontaneous abortion, neonatal death, premature labor, large baby, hydrominions, toxemia of the pregnancy. Preparation of OGT, OGTT, and it's a normal diet with normal carbohydrate for 3 to 4 days. Certain drugs should be avoided, that is steroid, to remain fasting for 8 to 12 hours, 75 gram glucose in 250 ml of water. Interpretation of oral glucose tolerance test: normal, all the level are within 140 milligram per deciliter. Mild diabetes mellitus, one or more bellows will be above the 200 milligram per deciliter, and moderate, almost all bellows will be above 200 milligram per deciliter, are severe, all bellows above 250 milligram or more. This is the curve here. This is the normal curve. This is mild, moderate, and severe. Hyperglycemia, causes of hyperglycemia: diabetes mellitus, elementary glycosuria, hyperthyroidism, hyperpituitarism, hyperadrenalism, administration of anticorticotropic hormone or cortisol, general anesthesia and convulsion. Hypoglycemia, causes of hypoglycemia: overdoses of insulin, hyperplasia or tumor of the islets beta cell of the pancreas, hypopituitarism, hypoaldosteronism, anorexia nervosa, and severe liver damage. Morphology of diabetes mellitus and its late complication: islets changes, diabetic microangiopathy, atherosclerosis, neuropathy, ocular complication, nephropathy. Here, this is the complication of diabetes in figure. Here, I in pointer আছে I so retinopathy, in case of eye retinopathy, the retinopathic cataract glaucoma in case of eye, brain microangiopathy, cerebral vascular infarction, hemorrhage, blood vessel hypertension, heart myocardial infarction, islet cell loss, insulitis, amyloid, atherosclerosis in blood vessel, in kidney, glomosclerosis, arteriosclerosis, pyelonephritis, in hand and foot, also here peripheral neuropathy, autonomic neuropathy, and in case of lower limb, uh, peripheral neuropathy and atherosclerosis occurred as a result gangrene, and um lastly amputation of the foot may be occur. Conclusion: diabetes mellitus is a common disease in the world. It causes long morbidity and many people die due to acute complication, ketoacidosis and hypoglycemia, and late complication by involving blood vessel and kidney. Atherosclerotic change in medium-sized arteries causes myocardial infarction and cerebrovascular accident and lower leg gangrene. Diabetes causes most of the end-stage renal disease, and patient require dialysis, kidney transplant, and ultimately death. It is a strongly genetic and familial disease and tragic cause of death in members of the same family, although it is non-communicable disease. Management of diabetes mellitus requires multidisciplinary approach. Incidence rate in Bangladesh 14.2% at present, and it will be 15.3 in 2045. Newer resources are mandatory for prevention and treatment, like gene therapy may be helpful to check the rising incidence of the disease, and we are looking for the future scientists, particularly medical scientists, to work in the field. Thank you. Thank you all.